Whew. Wow, that goes well in an acoustic version. So I remember my first ever drum lesson when I must have been in like year five, maybe 10 years old, 11 years old. I can't really remember. But I went into the drum lesson and the drum teacher, first thing he said is, "What do you want to get out of drumming?" And I hadn't thought about that. I was just a kid. And the first thing that came to my mind was, I want to be able to play the drum beat to Paper Cut. Now, I know this video is about crawling, not about Paper Cut, but the Paper Cut song by Linkin Park is like, yeah, I'm pretty sure that's the Paper Cut song. Yeah. Anyway, I just loved that drum beat so much. And ever since then, Linkin Park has been in all of my playlists. I'm not claiming to be the world's biggest fan by any means, but I did really enjoy their music, especially through the 2000s. And I know a big part of their music was to promote mental health awareness, to make people who are suffering feel connected with. And I know that they did that because I've met people throughout the years who really connected with their music. And one of their big songs that people who are suffering and struggling love to listen to or feel, understood when listening to is Crawling. Yeah, Crawling, and it's a song I know and I've enjoyed listening to, but I've never really listened to the words more than that. It's just kind of been one of the songs in the playlist. So I thought, what a great opportunity. A friend of mine recommended I should do that as part of my music psychiatric reactions, where I listen to music, or listen to songs and provide a psychiatric perspective on some of the themes that they discuss. And I thought, yeah, that sounds really good. And so this version of Crawling was released, I think it was performed just before Chester Bennington took his own life. So quite a special version of it. It's a live acoustic version, I think. I don't know if it's acoustic. I just know that it's live. So I'm excited to listen to it. Now, if you're new here, a warm welcome to my channel. My name's Dr. Sil. I'm a junior doctor from Australia. And in my free time, I like to make mental health educational content and react to music videos in some of my content. Now, all this content is speculative in nature and it's general advice only. There is no patient-doctor relationship formed. But with that said, let's get into it. Oh, I'm excited. Although I have heard Crawling, the original version released way back in the 2000s, I've never heard this live version, and I love live versions of songs that I enjoy. So let's listen to it and let's reflect on the content of the lyrics.
There's something inside me that pulls beneath the surface, consuming, confusing. This lack of self-control I fear is never ending, controlling. I can't seem to find myself again. My walls are closing in. I felt this way before, so insecure, crawling in my skin. These wounds, they will not heal. Fear is how I fall, confusing what is real.
Whew. I think, wow, that goes well in an acoustic version. That is so beautifully connecting. And the fact that he's in the crowd there is so moving. I also like that the crowd isn't like going nuts. They're in it with him. They're attuned. Attuned is an important word in psychiatry. Attunement is something that a lot of people can do unconsciously, and that's a good thing. It's mentalizing what someone else is going through and being kind of in the same level as them. So when a caregiver cares for a baby that's crying and realizes that they're crying because they're probably hungry and then feeds them, that's attunement. They've mentalized what the baby must want. They've put, they put themselves in that baby's point of view in a way and attuned to what they need. And that often happens in music and art where, although this is not a baby and a caregiver, this is a musician and a crowd, but there's a relationship there. It's not a classical relationship, it's a different kind of parasocial relationship, but there is a connection and there is an attunement that's needed. And so that's a very moving setting for this piece of art. So looking back at these words, I've heard this song probably maybe 100 times in my life. But I never really listened to the words, sorry to say. But now I'm hearing it like the idea that he's got these wounds that will not heal is very provocative to me. It makes me think about how psychological injuries, such as trauma, manifest physically. That's the feeling, the crawling under the skin. That is the physical representation of a psychological trauma or injury. The line around confusing what is real is very profound because when and this actually is very, you see this commonly in a disorder called borderline personality disorder, where the intensity of the emotions, the intensity of the trauma that they've experienced, and consequently the intensity of the emotional dysregulation is so intense that reality testing, knowing what is real, can become impaired. And historically, that's why it was called borderline, because it was on the borderline between neurosis and psychosis, where they could border into a psychotic state, it would look like. What a horrible place to be, that your emotions can take you out of reality. That is a very painful illness. Fortunately, people who suffer from emotional dysregulation, personality vulnerabilities, can have pretty good outcomes. And after 10 years, usually the outcomes are like most symptoms have resolved for most people. So that's very positive. But it doesn't come automatically. That's the issue. Emotional regulation is something that needs to be learnt. It has to be trained. It's something that if you don't have it by the time you're a teenager or a young adult, you need to learn those. Well, one has to train those skills themselves a lot of the time. And there's lots of effective therapies for this, by the way. The most commonly discussed one is dialectical behavioral therapy, which mixes a bit of cognitive behavioral therapy, where you challenge your thoughts and your thought patterns and think about how your thoughts affect your emotions, and then changing cognitive distortions like catastrophization may help reduce depression and anxiety symptoms that follow. So it takes a bit of that, the CBT, but also takes a bit of a Buddhism perspective of mindfulness about coming into your body. And that ties back nicely to these lyrics, where we're talking about how trauma is a physical state. Psychological trauma can manifest physically. Well, guess what? The treatment is often physical. Okay, and there are movement therapists that work on this, and everyone has their own special movements. It's a nice way to think about it. For me, I definitely am a big proponent of using exercise to help be as one of the things that generate a positive mental health picture. It's one of the many tools you can use. And often complex problems have complex solutions, so you need a multimodal approach to treat mental health, and so exercise is a very important part of that. And it's about finding what movements are right for you, right? For me, it's boxing. I think having an aggressive outlet is really, really helpful for sublimating stress and anxiety that comes from other parts of life. So what does that mean? Sublimation is a very important defense mechanism. It's when you take the anxiety or distress from one thing and you put it into something else that's more healthy. So if I'm driving and someone cuts me off and I get angry, it's not a very healthy defense mechanism for me to pull that car over and get into a fight, right? Much healthier, take a deep breath, go home, punch a punching bag for 30 minutes, and hopefully that will help. That's a very simple example, right? I'm just trying to give the example of what sublimation is. So, and how important physical treatments are in trauma response. I think a lot of the people watching Linkin Park are people who have suffered from trauma, but may not necessarily have ever tried therapy. So one thing I really like to make clear to people who are, survivors of different traumas, but haven't yet tried therapy, is to realize that you don't have to talk about your trauma, especially not right away. So that's a big fear people have. Oh, I'm going to go in the room, they're going to say, tell me about your mum, and you're going to have to go, oh. So no, not at all. Therapists are trained in not over, not overstressing the participant. So yes, there will be challenging times in therapy where you have to kind of discuss, unhelpful defense mechanisms you might use. That tends to happen, but you don't have to go into trauma if it's, if you don't want to. It's led by you, therapy. You're the kind of leader. And therapy can just be supportive around helping strengthen your defense mechanisms. You don't always have to go into your unconscious and do psychodynamic psychotherapy. And cognitive behavioral therapy is very much more. It's much more practical than all that. You're looking at experiences you've had, you're looking at what happened, what was your style of thinking, how you can change that style of thinking with different techniques, and then the next time that incident happens, you try the different techniques out and you go, oh wow, like maybe this type of thinking can be challenged and things can be better for me. And that is an evidence-based treatment for depression and anxiety. There is good evidence that can help alleviate serious symptoms of depression and anxiety. So working with a therapist can be really helpful if you've experienced trauma, and you don't necessarily need to go into the content of that trauma if you don't want to. And I know this has been a very long reflection, but it's a short song, so I'm permitting myself to rant a little longer than normal. But these wounds will not heal. Very powerful line. Definitely, a strong sense of hopelessness in that line. I don't know if trauma wounds heal, but they scar. So what is a scar? A scar means that the wound can close, but that tissue is no longer functional. And you have to learn ways to function around it. This is all very metaphorical. I'm just kind of exploring a creative metaphor here. But people can grow after trauma and get new insights into their own unconscious and into who they are and into how they want to live. That can be helpful. People who have had really rough childhoods can use that pain to be altruistic, to then be better parents than their own parents, right? That is a really positive outcome from a really horrible situation. So I am quite hopeful that someone who suffers from psychological or physical trauma, especially childhood trauma, and is suffering from mental health symptoms can have an improved quality of life with the right help and the right support. It's very hard to do alone. I do think it's important to seek help. And for those who are scared, just remember you just need to get to the front door. And once you get to the front door, the therapist will guide you, and maybe they're not the right fit. That's okay. At least you tried. And that is so good. All right, that's a long enough rant. Let's keep going with the song.
Using what is real. Discomfort in this thing has pulled itself upon me. Distracting, reacting. Against my will, I stand beside my own reflection. It's haunting how I can't seem to find myself again. My walls are closing in. I felt this way before, so insecure.
So good. I mean, how haunting is it that, only a few weeks after this was filmed, that he took his own life? Just that moment where he smiled just then felt so authentic. And maybe it was, maybe it wasn't. I can only speculate, but it's a reminder that people are incredibly good at putting on masks. Yeah, and suicide is an absolute, it's horrible. It's a catastrophe. And although, I heard it's very, very provocative and an important line that suicide is preventable, but it's not predictable. And this makes me think of that. Like he's got this, well, I don't know about Chester, but people can have this really convincing mask that everything is fine and things aren't fine. And vice versa, people can say that they're about to go in their life and they're not. And so how do you know who's going to do it? Well, the reality of the situation is that there has been no accurate risk assessment tools that can rigorously and accurately predict suicide. That's a very difficult, truth. So what we do is not risk prediction in psychiatry. We can't do that. We do risk assessments and risk formulation. So instead of saying someone is high risk or medium risk or low risk, what does that even mean? That is not helpful from a psychiatric perspective. What I want to say is their risk elevated? Is it chronic or acute? And what is affecting their current risk? What are the stresses? What are the supports? What can we do in our multifactorial management plan to address the acute stresses to risk and support the supports to reduce the all-round risk? And that can produce a formulation that is unique to the person that can, produce a comprehensive management plan. Yeah. Let's keep going.
Crawling in my skin, these wounds they will not heal. Fear is how I go, confusing what is real. Crawling in my skin, these wounds they will not heal. Fear is how I go, confusing what is real.
Did you see what that guy said? He said, "Thank you. Thank you." A moment like that just generates such gratitude. That's how beautiful life can get. I just wish I was there. Don't you? There's a beautiful set of YouTube videos called One to One, and it's when artists go one-on-one with an audience member that gets picked out of a crowd, and just perform for this one person. It's obviously filmed, and so we can all benefit from it. But what a profoundly moving experience. Maybe a little bit intimidating as well to be that one person. But anyway, that just was such an intimate experience for that group. That was very moving. Rest in peace, Chester. Yeah. All right. That's it for this video. Comment down below whatever you want me to react to next, and I wish you a beautiful day full of love. And if you feel like you're struggling, please reach out to someone. And if you haven't seen a therapist but you think you probably would benefit from it, you know what I'm going to say. Get to the front door. Just get to the door of the therapy clinic. Make the booking. Just try it. All right. Bye for now.